Hi everyone, welcome to the CME on Guidelines of Breastfeeding. I am Dr. Sumita, pharmacologist from Chennai. So World Breastfeeding Month is celebrated in the month of August. So the theme for 2023 is Enable Breastfeeding, Making a Difference for Working Parents. So coming to the incidence of exclusive breastfeeding in India, it is about 55%. And when it comes to the incidence of perceived insufficient milk supply among breastfeeding mothers, it is 10 to 25%. So there are 4 signs when we can say there is a good latch of the baby towards a mother's breast. That is, the baby's mouth is wide open. Majority of the mother's areola is inside the baby's mouth, and the baby's chin is touching the mother's breast and the lower lip is turned outwards. So there are breastfeeding position which is very helpful for the mother as well as for the baby based on their health conditions. So there is a classic position is cradle hold position, where the baby will be positioned to one side and the baby's head and neck will be supported by the mother's arm, and then here the position is tummy to mummy position, that is tummy of the baby is positioned towards the mother's stomach. So next position is cross cradle hold position. This will be very helpful for babies who is having latching difficulties. And then here when there is a latching difficulty, we can say the body of the baby is supported by the mother's arm, opposite side where the mother is being breastfeeding the baby. So next position is football position or clutch hold position. This position is very helpful for mothers who is having cesarean section pain, as well as it is helpful for twin babies. And this position, what happens is the pillow will be positioned to one side and the baby's head, neck and the body will be supported by the mother's arm, and then the baby's feet as well as the leg will be tucked under mother's arm. So next position is double rugby ball hold position for twins, as we can see in this picture. Then reclining position in biological mothers, it is a normal nurturing position for the mother, where the mother will be reclining backwards and the baby will be in upright position with their toes pointing down. Saddle hold position. This position is helpful for babies who is having ear infection or tongue tie, where the baby will be made to sit in the mother's thigh and their head, neck and the body is aligned straight and supported by the mother's arm. Dangle feeding position. This position is helpful when the mother is having mastitis, that is inflammation of the breast, as well as when they have the blocked milk duct. When their milk output is very low, what the mother does is the mother can dangle over the baby, crouch over the baby and dangle her nipple in the baby's mouth, and she can use the pillows for the cushion. So the next we can see about the expressed breast milk. So when it will be helpful for mothers? When the mother is going back to the work but still she want to continue the breast milk for her baby, she can express the breast milk, and it is also helpful for low birth weight and premature babies. When they have this feeding difficulty, this expressed breast milk will be helpful. Breast milk can be expressed. It can be expressed by hand or by pump. It can be a handheld pump or it can be an electric pump. So once you have expressed the breast milk, what is the technique for storing the breast milk? That is very important for the mothers, because the storing of the breast milk determines the nutrients of the milk which is to be given to the babies. So it should be stored properly. So how we can store the expressed breast milk is freshly expressed or pumped breast milk. It can be stored in the room temperature up to 4 hours and in a refrigerator up to 4 days, and it can be kept in a deep freezer for up to 6 months. Suppose if it is previously frozen and it is thawed milk, it can be kept up to 1 to 2 hours in a room temperature, 1 day in a refrigerator, but it should never be frozen again. Then next, leftover feeding milk, it should be used within 2 hours. The guidelines is given by Center for Disease Control and Prevention 2022. Human milk bank. From the human milk bank, the mothers, she can get the donor pasteurized human milk. So when it will be helpful? This will be helpful in a premature and also low birth weight babies when the mother is having absent lactation or insufficient lactation till her milk output improves. The mother can get the help from it, and it is also useful in babies whose mother, they have been died in the immediate postpartum period and also babies whose mothers is having postpartum illness, or the babies they are at health risk when they get the milk from their biological mothers. So where this human milk centers is available, milk bank centers in Chennai available is, it is available in government setup as well as in private hospitals. In government hospital, it is in Institute of Child Health Egmore, Institute of Obstetrics and Gynecology Egmore, and Kasturba Gandhi Hospital for Women and Children Chepak, and Vijaya Hospital Vadapalani, and Rainbow Children Hospital Gindi, and Kanji Kamakodi Children's Hospital Nungambakam. So via this milk bank they can get the help. So this is an awareness or important info regarding the breastfeeding and it will be helpful for breastfeeding mothers. Thank you for your time.